How is healthcare funded in Venezuela? Have you ever wondered how a country like Venezuela manages to fund its healthcare system? Let's break it down and see how it all works. Venezuela's healthcare system is built on the principles of socialized medicine, which is a core part of its socialist economic framework. This means that the government plays a significant role in providing healthcare services to its citizens, aiming for universal access regardless of personal finances. The funding for healthcare in Venezuela primarily comes from the government. The state allocates resources to support public healthcare facilities and services. In a socialist system, the goal is to ensure that essential services, like healthcare, are managed and funded by the state. This is intended to create greater equality and access for everyone. Historically, Venezuela's socialist government has aimed to provide free healthcare to its people. One notable program is called Barrio Adentro, which was launched by former President Hugo Chavez. This initiative focused on delivering healthcare services to poorer communities, often with the help of medical professionals from Cuba. However, the reality of funding healthcare in Venezuela has faced challenges due to economic difficulties. The country's economy heavily relies on oil revenues, which can fluctuate greatly. When oil prices fall, the government struggles to maintain adequate funding for public services, including health care. This financial strain has led to a decline in the quality and availability of healthcare services, despite the ideals of universal access. In practical terms, the amount of money the government spends on healthcare is often not enough to meet the needs of the population. Compared to other countries, Venezuela allocates a relatively low percentage of its gross domestic product to healthcare. This lack of funding has resulted in shortages of medical supplies, equipment, and healthcare personnel, worsening the situation. From a socialist viewpoint, the intention behind Venezuela's healthcare system is to ensure that all citizens have access to necessary medical care as a fundamental right. However, the economic realities have made it difficult to fully realize this vision. The challenges of sustaining such a system without stable and sufficient funding are evident in the current state of healthcare in Venezuela.